Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. J. Calvert, and I'm over-cheesed and over-wined back from Paris, and God, had a lot of interesting academic work there with my amazing podcast partner here, Dr. Millicent Rovelo, fresh off the panel that made people just scared by what you do.
It either made them want to eat more wine and cheese or not eat any more wine and cheese. But no, yes, we are freshly back from Paris, and we had an amazing time, and we learned a lot, and we did a lot of things and adventures and activities. So we're just going to do a little bit of a download of everything that we did.
So first of all, to paint the picture, 20,000 participants at this one.
Oh, wait, but doctor, I have a question for you first.
Yeah.
What does IMCAS stand for?
See, now,
quiz.
But I was justified because...
What does it stand for?
It stands for the international meeting, right? Is it, I can't remember it.
Master.
Oh, that's right. International Master Class on Aging Science. But it used to be the International Master Class on Aging Skin. And that's what somebody, I think it was Mark Monty that said that, right?
Yeah, he justified
He justified my...
original.
Right. So
yes.
because he remembered it from back in the day also, but at some point they changed it. And, we just have to give props to, Hugh and Sebastian for running just an amazing, and of course, Dr. Asher for, creating this whole thing. But now it's just a beast of a meeting. 20,000 participants, registrants.
Yeah, that's huge. So
1,000 speakers.
It started out as a dermatology and aesthetic medicine conference, and then a while back they added in the surgeons, the plastic surgeons. And so now it's just this behemoth of a meeting in Paris, and the organization has offshoots, in Shanghai and out here and there, different places. But this is the global one that happens every year in Paris, and it draws participants from Latin America, from Asia, from the Middle East, from Europe, from Africa, from everywhere. And these are dermatologists, plastic surgeons, and aesthetic medicine professionals. So these could be people who are nurse practitioners, assistants, just internal medicine people that do any kind of aesthetics. And the meeting is geared towards aesthetics and science and skincare. And it is, as you said, huge. So this is a giant platform to discuss really all things aesthetics.
Yeah, and kudos to you for getting onto these body contouring panels with these. These guys are giants in the field. I mean, you had a couple of panels, and then you moderated a surgery, and I think. One panel on the massive weight loss patients that you did, like there were gasps from the audience at some of the cases you showed. I mean, really, there were. And people were like, "Oh my God, how'd she do that?" And it was great because Dan Del Vecchio made a great comment where he said, he's up on the panel with you and asking you questions, and he said, we're looking at those cases, Dr. Rovelo, and just going like, who would even want to take that on? Who dares to do it? And you just turned them into amazing results. And I was watching those cases just going like, I wouldn't do that. Like they're so hard. And your response was, well, if I didn't do these cases, I wouldn't have any patients.
That sounds like something I would say. Yeah.
It was hilarious. You're like, yeah, well, these are my patients. So like I have to take care of them. That's who comes to me, and that's what I do. And here they are.
Right. Yeah. The panel that you're referencing was about safely doing body contouring cases in patients with an elevated BMI. So the standard answer, and actually that's what one of the panelists asked me, like, what is your cutoff for a BMI? Because historically, the answer has been 30. That's what he suggested. He was like, well, 30 is the answer.
And just for our listeners, body mass index is basically height versus weight. Essentially, like if you're 5 feet tall and weigh 300 pounds, you have a high BMI. If you're 5 feet tall and you weigh 100 pounds, you have a low BMI.
And the age-old standard is that the higher the BMI, the higher the chance of complications, the less desirable aesthetic outcomes, and you really shouldn't be doing cosmetic, plastic surgery elective cases on patients with BMIs higher than 30. Well, as I referenced, I wouldn't really have any patients if that was the case. So I have developed a system of doing these higher BMI patients fairly safely with good results. So that was the point of the talk that I gave. And then there were some other talks as well. I had one on complex revision breast. So these are breast augmentation cases. I specifically focused on the IMF. If you've ever followed our podcasts, I harp on the IMF, the inframammary fold, all the time and how critical it is. And this talk was geared on how to address problems with that in breast augmentation patients.
Yeah, and it was... this was just an awesome surgical meeting. I learned a lot. I did do my live surgery. The panel I learned the most on was actually my master class in facelift surgery, where I was talking about combining the endoscopic upper face and then with the lower deep plane facelift together and how I blend those things. But I learned more listening to the other experts with their experience, which was great. I mean, that panel was awesome. But the highlight was doing the live surgery. They had come in August, filmed my surgery, and then
this was a rhinoplasty.
It was a rhinoplasty. This was a revision rhinoplasty, and I'm looking at the patient who is awesome and lovely and just a great patient, and I'm going, this is such a hard case. Why did I pick this one? What was I thinking? It was so difficult. The nose was kind of twisted off to the side, and she'd had 3 previous rhinoplasties, and the way that they did it, they put me in the cadaver lab with a specimen that I had pre-dissected the day before surgery.
In Paris.
In Paris.
Yeah.
So I go on.
You did the surgery here.
I did the surgery
in August.
They filmed it. Cut it down to a 2-hour video. And then they're going to play that in the auditorium with a panel of experts. So there was, just a bunch of surgeons who probably you guys don't know, but because they're international, but they're amazing people. And Jean-Bryce Duron and some really nice, French surgeons, and they were kind of asking me questions. A good buddy of mine from India, so it was really fun to have them kind of pimping me on my surgery while I'm sitting in the cadaver lab with the residents from a local program who are assisting me. And so I had the specimen pre-dissected, and I was showing this is how I take the rib, and there was a very clear-cut script on how Sebastian wanted the kind of the presentation of the surgery to be. And I thought it went really well. It was it was a really hard case, and so they kind of kept saying do you really need to do that? I was like, yeah, well, if you want it to turn out right, you kind of do. And, as I'm watching it going this is a really hard case. I guess because it's just one that I do. That's what I do in my practice, just like you do these people with BMIs of, 38, and you make them look like they're ready to go to the beach in a bikini. I take noses that people go, it's just not really.
Do you really want to do that?
And usually when I make the incision and I'm dissecting through it, I'm like, this is going to be a hard one.
Right.
And it was. And to get it right was difficult. And it's not perfect. None of these revision rhinoplasties are perfect. None of them are. There's always something that's, it's been damaged. It's just the way that it is. But you can make them look great. And that's the key, is to make it look very natural, normal, beautiful, and she has a great result. I'm very happy for her. But the presentation was kind of cool. I like that format.
I definitely do. That was the one panel that I moderated, was a live surgery as well. And
that was great, by the way.
Okay, that was for lipedema, which is probably something we should break down in a separate podcast.
Yes, we do need to do that.
Lipedema is an abnormal distribution of fat. It can be anywhere, but very commonly in women, it's in the lower legs. And so, as opposed to the upper legs, the legs. And the surgeon who was doing the case had recorded it live, as you had previously, and she was showing how she did liposuction of the lower legs from the ankle to the knees. And then at the same time, while her surgery video was playing on the screen, she also was in the cadaver lab live doing a specimen dissection on the cadaver and showing us in real time sort of what she was doing. And they've scripted these out. We had at 4 minutes, 37 seconds, this is the question that you need to address. They have it timed like clockwork. And I learned so much in that moderating myself, even though I was just watching about how she addressed lipedema and what her protocols were. So there's so much learning that goes on across all the spectrums, no matter if you're there as an attendant or as someone speaking or moderating. There's so much knowledge coming from such a vast source of information that it's really incredible.
Yeah, and there was there's just a real like hunger for knowledge at this meeting. Like people go there expecting to get a lot out of it. In fact, I was in a derm session where they were talking about threads, because I was sort of like, that's curious to me. Like, why are these threads so popular? And they're popular because they're inexpensive, they can be done by almost anybody, and they do get an effect. Mm-hmm. So threads they're here to stay. I can promise you that. Maybe we'll start doing them, maybe it's I don't know, maybe it's like an intro to like, I don't know. I've been really thinking about it a lot, and this meeting kind of got me going on it. But so I'm in the derm session. They ask, is there a plastic surgeon in the audience who can comment on this? And I'm the only plastic surgeon, and there were 200 people in the session, maybe more. So I go to the microphone, and they all have questions about, what do you see from the first question? What do you see from threads long term? And I tell the story about Kimberly Cates, who did our podcast and had all these, micro threads throughout her face, and it destroyed her skin. But then I also say, but more commonly, what I find is I'm doing a lower, face and neck, a deep plane, and there are some proline, permanent threads through there that I just kind of haul out, and they don't really have a whole lot of consequence. And the absorbable ones tend to go away. I don't really see a lot of consequence with those either. So I said, depending on the material and the practice and how they're done, variable, but in general, not a very big issue. And so they were, and then I'm sitting there thinking to myself, maybe they should be, we should be, as plastic surgeons, kind of like looking into this a lot more, because it's not what we do. We don't really go after that kind of part of it. So like that cross-pollination of specialties, I think, is really important.
Yeah, absolutely. There's so many other things that are not surgically geared to learn about and to know when you're there. Even just the different machines and lasers and fillers and skincare.
So many.
That are on display across 3 different levels of this conference area. Like, it's the amount of, we get a very isolated and limited scope here in America, mostly because of the FDA and what they allow to be used here in the United States. But outside of the United States, oh my gosh, there are so many products available that we will never see. But the science is out there, and the technology and the materials and the products are really incredible. And there is something to be said for FDA clearance. I'm not knocking it. We do want to be able to use products that are safe. But just know that there's a lot out there that we're never going to see.
Well, and it's not that these products that are out there are not safe. They probably totally are safe, but the companies are these small companies, and they look at the mountain of data that they need to provide to the FDA and the price tag associated with that, and it's just not. It's not
worth
happening.
It. Yeah,
it's not happening. It's just not like, they make an acne zit buster cream that we're never going to get because they've combined a little bit of adrenaline and some emollients to deliver it, and it's just it's never making it to the States.
We're never going to see it.
No way.
The Motiva implants that we talked about a few months ago, they were in the FDA process for 6 years, if not more. It takes a long time, a lot of money and dedication and independent studies to make that hurdle. So that's why. Yeah,
and then you have to say, okay, so Motiva did all that. Now they got to sell the implants. They're entering a Me Too market, and there's a reason why they had a lot of trepidation going into it. But I think that's a device, just not to get off topic, but that's a device that I think they did the math and they said, you know what, we do present something that we can win, so that's why they went and did it. But these little tiny companies, they're never going to do it. I think I brought back a bunch of threads too that I was going to look at and see how they work. But I really got a lot out of that. Sort of thinking as a dermatologist on skin, and we do so much surgery, but and we have the Rock Spa, and we have Orla, and and we have just incredible estheticians and great products, and and Christina down in Newport doing, potenzas and lasers and all that stuff. And it's really, really important. That's a big part of the practice. Like,
Right.
People, we can operate on the skin, but if you don't keep the skin looking nice and taking care of the volume distributions and doing the Botox correctly, you're kind of missing a big part of the aesthetic result.
Oh, absolutely. And I think the Europeans and the other Asian countries and Latin American countries, African countries, they probably do a better job than we do when it comes to skincare. I mean,
Yes.
certainly in France, getting like your monthly facial is just part of what you do, like getting your teeth cleaned. Like they put a huge emphasis more so on skincare, I think, even than plastic surgery. Whereas in America, I think we're definitely more like dramatic results oriented and plastic surgery and befores and afters. Over there, it's like skincare and maintenance, and they do a much better job. So as a result, they have these products and these ideas about really how to take care of your skin in ways that we just don't have. And it's really great to see that and get that outside perspective that we don't normally get.
Yeah, I thought it was great. I got a lot out of that. And, I just, that meeting has gotten to be just so mega, and I went to the one in Brazil earlier this year, which was still like 3,500 people. It's not like a small meeting. It's bigger than any of the plastic surgery meetings we go to here. Like, it's way bigger than the one we're going to go to in Austin in March.
Like 1,500 max.
Maybe.
Right.
If they get 12, they'll probably get 1,100 and say it's 1,500.
Yeah, and that's for the aesthetic plastic surgeons in the United States. So yeah, think about that, like 1,500 versus 20,000.
Yeah, so like the one in Brazil was 3,500, and I thought the content was even a little bit more personalized because it was a smaller meeting. Like the number of surgeons that were there was very sort of manageable, and there was amazing programming for 3 days or 2.5 days there, and it was awesome. And so I think our meetings here need to go more that direction. Instead of it being the problem, and I expressed this to the president of the Aesthetic Society. I said, the problem with our meetings is nobody's looking for new ideas. They're just, the same people getting up there with the same slides for the same, messages over and over again, and they don't really go to look for, somebody new to come in and say, hey, this is how I'm doing it. And, it's a little too much cronyism. It's a little too much like, get so-and-so to do that, or get this guy, he's on the board, or IMCAS, like they throw all that out, I think it was, the speakers that I saw, talking about facelifts and rhinoplasty. I mean, there were some old guard guys there for sure, and maybe I'm getting into that category myself now, but like your panel, like the body contouring and panel, that was a lot. There were a lot of young people up there that had amazing ideas with beautiful results. I mean,
the body contouring and the high definition stuff coming out of Latin America is like next level.
It's mind blowing.
It really is. Like we're nowhere near there yet for a variety of reasons, but just having exposure to it is like seeing what's happening sort of outside this country and what is considered a little bit more fringe right now, but which probably will become more mainstream over the next decade or so. It's a really good vantage point.
Yeah, I mean, I think there's like, I was looking at like Hoyos' stuff, and I was just like, Mel, maybe you need to like go to Columbia and see what they do there and see how that gets done, because I'm sure we're set up to do it, in Beverly Hills, and they just they have a whole different. It's a whole different vibe about like how aggressive they're going to be to like
aggressive. Yeah,
they want people to like go into the like. The body contouring machine and come out like ready. And here's your thong bikini. Head to the beach.
Yeah, get your spray tan and head on out.
That's right. Good luck. They really think that way, and that's very different than we're a little more conservative. Like safety issues are there. I mean, I will note that in one of the presentations, which will remain nameless, that when you do a presentation like. You don't have like a complications category that includes deaths.
No.
So you don't have that, right?
That's not on my list of complications.
Well, they have that in South America. So deaths
has its own column.
Has its own column in most of these South American presentations. So that to me,
that's not acceptable. I can't do that.
It's not. And so there's somewhere between having that column in your complication profile and where you are, that's probably the right place to fall into. But, I do notice that. So there's a lot to be learned. And that's our job as plastic surgeons, is to go there, get this knowledge, and then integrate it into our local surroundings and how we do things, and just produce the best possible results for our patients that we can. And it's very satisfying. I thought that I love that meeting. It's a lot of fun. I'd like to go to the one in Thailand that they do. They've been doing that for 17 years. Did you know that? So that one's been going on for a long time. So, any other comments or thoughts on IMCAS?
Nope, that's it. I just always come back very motivated to do better, be better, and to achieve more. So I'm looking forward to the next year, and then certainly looking forward to going back.
Well, there you have it. So thank you to our good buddies, Sebastian and Hugh and Benjamin Asher. And this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.